And welcome back to the morning show, ladies and gentlemen. I've got Dr. Christina here from All Wellness Medical Center. Good morning.
Good morning.
Good to see you.
Same here.
White coat syndrome, my blood pressure just went up.
I
There is
know.
something to that, isn't
Absolutely, absolutely. My mother, every time she would go to the doctor's office, her blood pressure would go up, and it would seem like she had hypertension, and her blood sugars would go up.
there? Oh, sugars too? Really?
Yes. So some people are
Wow.
just scared.
Yeah,
Right,
yeah.
And you can tell, lab coats, there's different levels of lab coats.
Is it?
Yes. So anyone who goes to the doctor, if you have someone that has a really short lab coat,
Yeah?
then that's usually a medical student.
Okay.
Then if you have one that's kind of like to the mid, like just barely covering the butt,
Yeah?
then that's usually a resident or, usually a resident, I would say.
Okay.
And then if you got one that has a little longer, then that's the professor. That's the one you want.
That's the one.
The other two, it's like they're in training. It's like babes in training,
Is that right?
And you just say, no, thank you, I'll wait. And you never go to the hospital in July, because July is when the turnover of residency programs. So those.
No kidding.
Yeah, so the hospital, because the way they train us is like, oh boy, you're there, first day, okay, I want to do surgery, I want to do this, I want to do that. So you want to do all
But
the
it came
procedures.
in for a sprained foot. I don't care. I want to do an appendectomy.
I know. Oh, I found this, I found this, I found this, So I used to tell all my people, please do not go to the hospital if there's a residency
Oh, my
program
gosh.
near you. Try to stay away.
Yeah.
Because all the little residents are out.
I had no idea.
Yeah. Well, how do you expect us to get trained? You have to see one, do one, and then, you're
That's
on
why
your
I was
own.
born in July.
Yeah,
My
that's
mother
right.
went to the hospital.
They induced you
What the
early.
hell's wrong with her?
I
That's
know.
awesome.
It's kind of scary.
It is. Well, for the longest time, I'd never heard of white coat syndrome, and then some assistant one day told me she's got high blood pressure. I said, well, it isn't normally like that. She said, I think you got white coat syndrome, and I started thinking about it. Yeah, I was a little bit elevated,
Right.
and so I just started talking myself down. I started thinking about my little condo in Puerto Vallarta that I used to have, and everything just settled right down.
I know. Well, sometimes people, you brought up a good topic, to be honest with you, and we can talk about this.
Yeah.
Because the thing is that usually when somebody comes into the office and for the first time their blood pressure is high, they think they have high blood pressure.
Right.
And the deal is, unless it's extremely high, then the answer is no. So a lot of times, let them settle down, and then I'll walk out of the room and let's go ahead and recheck it.
Right.
But the other thing is, it would be a nice kind of idea that if your blood pressure is ever high, that you go get a blood pressure machine.
Right.
And now that they're digital, you can put it on your wrist, you can put it on your arm, whatever the case. And then I have them do what's called a blood pressure journal. So
Okay,
that
right.
way, when they're at home, and like I would do that to my mom, I said, Mom, we're going to do your blood sugars at home, and we're
Right.
going to do your blood pressures at home. And then you take that piece of paper to the doctor and say, this is what I'm running at home. And it's not the first time that it's elevated. It has to be at least elevated 3 times.
Okay.
Okay?
Yeah.
And the ones that are at the store, the ones that cut off the circulation to your arm, when you try to put your
Oh
arms
boy,
in,
they're
what
they're
the
a bear.
heck? I thought they were amputating my arm.
I know, huh?
I couldn't figure that one out. That was like scary.
This better be accurate.
Yeah, and a lot of times they may not be. So
Oh,
that's why
okay.
I'm saying this. A lot of people kind of like depend on that.
Right.
And it may be the machine's off. So why don't you go over there to another store
Right.
and go check your blood pressure there?
Well, obviously with my issues, I've had a blood pressure cuff at home with the little electronic thing for years, and
Yeah.
and now they've even got them, and I'm sure you knew this. They've got them where they will keep a record of what your blood pressure was, when, what day, what time, and it keeps all this on a record for you. So when you need to go back into your doctor, you just take a look and say, this is what it is.
Right, because we do like to get a copy sometimes, especially if we're really, really watching to see what you're doing. Because nowadays people are on like 3, 4, 5 different blood pressure medicines.
Yeah.
And when that happens, the key thing is that patients really need to get lab tests to check out their renal function.
Right.
Because some of those blood pressure and some of the medicines that we're on, unfortunately, they interact and can bring down your renal function,
Okay.
which can give you renal failure.
Oh.
So it's kind of a scary thing. And also, those people that are on diuretics, a lot of people want to be on diuretics just to lose some weight and water
Right,
weight and
right.
swelling and whatever. And it's totally fine to be on diuretics. But a lot of people don't understand that we can't just give you a diuretic for the whole year. we have to at least twice a year check to see what your electrolytes are.
Okay.
Because we have like potassium that's very, very important.
Right.
That any little shift left to the right can interact with your heart. And whereas if it's too little potassium, at least we can go ahead and tell you, okay, go ahead and eat bananas or any
Right.
potassium-rich foods.
Right.
Or we actually give you potassium to take. And then on the other hand, but if it's too much, then we have to give you medicine to bring it down. But the other factor that I want to say, because it just happened to me the other day, I had a lady that her potassium was quite high. So I went ahead and repeated it. And because there's times, if it's too high, you need to send them to the emergency room.
Right.
Because sometimes they end up giving them the medicine to help reduce the potassium before it affects their heart. But the deal is that at the lab, okay, and it's nothing that they did wrong, but the blood coagulates, and all of a sudden we'll get a false reading. Well, that has happened so many times to me. I went over there and redid it like that day, no matter fasting or not. And again, it showed high. So I sent her to the emergency room because I have two that are saying high. Then when they did it, guess what? It's normal.
Oh no.
Okay. So, but I said I had two highs. I can't overlook that. Plus, she
No.
was a cardiac patient. And a lot of times we have to do EKGs
Right.
on a cardiac patient or hypertensive patient or person that's on lipids or, for their cholesterol
Right.
for that reason.
Be darned.
Yeah.
Well, now another thing coming into the doctor, when you come in, and I believe this to be true, that just about every person that walks into the room has their blood pressure taken.
Yes.
A lot, not only the anxiety of the white coat, but the absolute rush to get into the doctor, the thinking about going in, that nervousness, even prior to seeing a white coat, is
Right.
part of it. Am I correct?
Absolutely. And also if they have to wait.
Okay. Yeah. Oh,
You know?
gee, I've never had my blood pressure increase because I had to wait anywhere.
But on the being the fair side of myself,
Right.
the thing is that and it's not, we never do it intentionally. I never do it intentionally.
Right.
It's usually something has happened, and I just can't walk out of a patient's room if I have to tell someone, or they tell me that their husband just died, or they lost their
sure.
husband, or something like that. Or for that matter, I'm having to tell bad news and whatever, and then before you know it escapes. And some people think, well, golly, are you overbooking or whatever? And it's not that at all.
Right.
I don't do what I call cattle call. I mean, my patients know that if I'm going to see them, they will get their answers. And a lot of times they will have like 20 million questions they want to ask, and then I have
Sure.
to kind of narrow it down and say, let's go over this part of it, and then another time let's talk about this. Because a lot of times insurances doesn't like us to be ordering so much, then they'll
Right.
start refusing.
So people need to understand that if they're in there and you're saying, okay, look, I need to tell you that this is very, I'll talk to you next time about it, right?
Yeah.
I mean,
Right.
you have to take that time with each patient.
Right.
And they should actually, and I know it's so hard to believe, especially coming out of my mouth, but sometimes you really need to appreciate the fact your doctor may be a little late coming out, especially if they aren't doing a cattle call, right, or overbooking like United. But yeah.
When they ask for volunteers, I'm going to be the first one to
I'm outta here.
I'm here. I got to go now. I'll take the 1,000 or whatever you're going to give.
But the whole idea of high blood pressure and whatnot, I mean, there are things that can cause it, but there's certainly other things that are easily remedied.
Right.
And
right.
So don't get too
Right.
panicky.
But the other thing is, if you get angry and your blood pressure goes up, but say you're not even angry, say you're just fine and dandy, or you're doing whatever, and then all of a sudden your blood pressure's here.
Yeah.
But then if it starts to go up, can you imagine what happens when you get angry? The biggest thing that we get concerned about is you're going to throw a stroke.
Right. Right.
Okay, and then we look at, oh my gosh, if that starts having, you start getting the biggest migraine you've ever, I mean, the headache from hell
Yeah.
that you can't get rid of, please go to the emergency room. I mean,
Immediately.
especially when your blood pressure is extremely high.
Yeah.
Because, and what do I consider as high? When you go past the 100 range on the diastolic, which is the
Okay.
bottom one,
Right.
the first number is systolic. That's the heart contracting.
Right.
The second number is diastolic, so when the heart is relaxing.
Right.
So when that second number is high, that's a
That's the
lot of
critical.
pressure.
Yeah.
That's a lot of pressure. And when your heart, it is supposed to be relaxing. Is there something wrong with the heart? So by then you need to make sure that, how can you do, if it is anxiety, people with anxiety will have high blood pressure. But it's like what you said, take some deep breaths, breathe it out. What you're doing when you're taking a deep breath in and you're getting that diaphragm going up and down nice and slow, okay? What happens is we have a nerve that goes from the diaphragm up into our vagus nerve that's up here. These are our baroreceptors.
Right.
And what happens is just slows down everything, slows down your heart, slows down the, can bring down a blood pressure. Many times we don't have to do any sort of intervention in the emergency room because of the fact that we have basically, you've quieted yourself down, by just deep breathing and just slowing down your breath.
Yeah.
Because we have a tendency to, when we are anxious and everything else, and this is the other thing too, when you're anxious, a lot of times people will just assume that it's anxiety.
Okay.
And it's not.
Right.
There's so many different things that it can be.
Right.
Thyroid.
Don't assume.
Yeah, don't assume anything, honestly, because that's where the biggest mistakes are being made.
Okay.
And especially for women's health out there, they always think that women, they're just anxious or they're just nervous or
Right.
whatever. But can a woman be anxious and be having a heart attack instead? And the answer is yes.
More likely than a man.
Yes, exactly. Because they do not have the same symptoms of a man where they have the crushing chest pain, the pain down the arm,
They
pain
just fall
in the
over
jaw.
and die.
Right. It's called, it's sudden heart attack. And that's the biggest thing that we all get concerned, especially for women.
Right.
And then they start having high blood pressure along with it. So now we're going to have, the idea is, are they, in by chance, if they have an irregular heartbeat and they're in what we call atrial fib, where the little atrium is just shaking away,
Right.
will they throw a clot at the same time that they have a high blood pressure and have a stroke and a heart attack? Yes, you can. So it becomes very complicated. But all in all, the biggest thing is that you're pretty smart, though. Our bodies are smart. They give us a warning sign.
Mm-hmm.
And the thing is, if there's something that you do not think is going all right with you, you're usually right.
Yeah.
And
Oh, yeah.
I don't care if you go to the emergency room 10 times because of anxiety, it's still, I'm sorry, it's not like woof, woof, woof.
Right.
It's, you may be saving your own life.
Right.
Or go to your doctor. Try to get in at that time and saying, I'm having a problem. Can I be seen? At least within that week, or at least within those couple of days.
Right. Right.
Okay, and especially, but if you start taking your blood pressure and your blood pressure consistently high, you need to inform the office and let them know it's persistent. But if it's at nighttime, can you call your doctor's office? Yes. But if they're not open, that's fine. Go to the emergency room. Go to the urgent care.
So I got to close this up, but the first line of defense then would be very possibly, a blood pressure monitor.
Yes, absolutely.
Would that be right?
Yes.
Accurate? And you can find them at all your drugstores. You really can, and you can pay anywhere from $50 to $250 for them. But get the one that suits you and start checking your blood pressure on a regular basis, day and night. Keep a log of it, and if it gets out of whack, then you need probably to take a look at it. Seriously, it will help you a great deal, help you live a little bit longer. Doctor, I want to thank you very much for
Thank
being
you,
here.
sir.
Always good seeing you. All Wellness, ladies and gentlemen, up on the Parkway. Stop in or give them a call, get an appointment, and come on down and see them. We'll be back with more of the morning show right after this.